Hello guys, hope you're all okay and you're all enjoying your life. Welcome back to Dr. Nadeem Awan ultrasound and radiology teaching video. The topic of discussion today is narrowing of cerebral aqueduct. It could be congenital and it could also be acquired. The best modality to confirm the narrowing of cerebral aqueduct is CT imaging. On the CT imaging, there is particular characteristic appearance of narrowing of the cerebral aqueducts. It could be dilated lateral ventricles. It is definitely dilated lateral ventricles and dilated third ventricle. Fourth ventricular dilatation would not be, because narrowing of the cerebral aqueduct causes the distension of the third ventricle and both lateral ventricles. As far as the treatment of this problem is concerned, because it's leading to increase intracranial pressure, so you have to drain and remove and to reduce this intracranial pressure by ventriculostomy. Or you can also have another option available, that is called as ventricular abdominal shunting. So you have to have ventricular abdominal shunting to take all this fluid out to release the pressure, and the patients will be normal. How we will be able to appreciate this on the CT imaging? There is a very characteristic example of the acquired narrowing of the cerebral aqueduct at the age of 14 years, and the child presented with the headache and confusion, nausea, vomiting, and all the other symptoms related to increased intracranial pressure. We did the CT imaging and we did find that this is the confirmed classical diagnosis of the cerebral aqueduct stenosis. So let's see this video. Old boy was suffering from the headache, and he had previously known hydrocephalus. So his CT images were performed, and on the CT images here, on this CT image, you can appreciate we are starting from the top to down. So here in view you can appreciate the frontal lobe and the parietal lobe. As I go down, so you will see this is the temporal lobe. Now we are in temporal lobe. Both sided lateral ventricles are grossly enlarged, and beside this you can also see ventricular shunting. So if I go down in view, you can appreciate on the both side there is visible caudate nucleus, and the convexities of the frontal horn are preserved. So mean there is no Huntington disease chances, and there is no atrophy of the caudate lobe. If we go down, so you will be able to see that the third ventricle is also enlarged, and markedly enlarged posterior horns of the lateral ventricles. If I go further down in view here, you can appreciate on the left side seepage of the CSF fluid into the occipital lobe. So this is what the communicating hydrocephalus is, and in view you can see that there is ventricular shunting. But the one point worth noting here is the shunt is only covering the right side, not communicating with the left side. So as a result, there is marked dilatation of the left-sided lateral ventricle with seepage of the fluid. If I go further up, so in view you will see that the both-sided paranasal sinuses are clear, and both-sided mastoid ear cells are clear. So in the conclusion, this is communicating hydrocephalus with the ventricular shunting, and so far the obstruction level is concerned, this will be a aqueduct stenosis. So this is communicating hydrocephalus due to the aqueduct stenosis.